Okay, I guess, huh? We can start. Perfect. So let's start the meeting. Good morning. I'm Erdal Sabri Ergen. I'm the Deputy Secretary General for Transport and Urban Development at the Union for the Mediterranean. I welcome you all. Thank you for being with us today. I also thank the moderator Sinai and the speakers Matthias, Sharp, and Mark, who will share their expertise in our webinar. I look forward to their presentation. Let me emphasize at the outset that it's a pleasure to partner with WHO and more specifically with the WHO European Center for Environment and Health, once more to organize a set of webinars on urban issues and health. Some of you will remember that 1 year ago, we co-organized a webinar on port cities and health, which in fact started our collaboration with the WHO. So we can say that this cooperation between the WHO and the UfM is now fast becoming a well-established partnership, if I may name names, thanks to Ms. Sinaya Netanyahu and on the WHO side, and Ms. Victoria Jimenez on the Union for the Mediterranean side. So for those who might not be that familiar with the Union for the Mediterranean, we are an intergovernmental organization based in Barcelona, 42 member states, 27 of whom are European Union members, and 15 non-European Union members from North Africa, Middle East, and Balkans. The Union for the Mediterranean aims to promote dialogue, cooperation, and the exchange of best practices, in fact, by concentrating its efforts on the two main pillars of action, fostering human development and promoting regional sustainable development. The UfM projects and initiatives strive to contribute to regional stability and regional integration. Today's activity is part of the work program 2022 of the Union for the Mediterranean. It's also part of the projects that were discussed in the regional platform on sustainable urban development and its working groups, which is the guidance forum on technical work for our division. In this platform and its working groups, we interact with the representatives of relevant technical ministries, such as those in charge of urban planning and urban regeneration, but also specialized institutions such as statistical agencies. If there are any queries about our activities beyond what is on our webpage, Ms. Jimenez and I will be available to provide information following the webinar. Coming back to the webinar, today's experts will provide us the latest evidence on how much the way in which we design our cities has a profound impact on the health of its citizens and how much the need to act on urban nature is becoming increasingly acute and urgent. We will also have the occasion to exchange views on good practices on the design and implementation of the relevant policies that promote health through investments into the protection of nature and green spaces in urban settings. The main message of the webinar is that embedding nature and green spaces in cities is key to achieve healthier communities and healthier cities. Since green spaces mitigate air pollution, heat island effect, and noise level. Thank you again to all of you for your interest in the topic. I urge you to actively engage the speakers during the question and answer session. Last but not least, I would like to remind all that this webinar will be the first of a series of 3 webinars on cities and health that we plan to co-organize together with the WHO in 2022. We look forward to seeing you there. So without further ado, I also welcome Mrs. Francesca Racciopi, and I would like to give the floor to her, who of course is from the WHO European Center for Environment and health. Thank you very much.
Thank you very much, Mr. Ergen, and you said it all. Many thanks for this brilliant introduction to the webinar, and welcome from the World Health Organization. We are hailing today, unfortunately, not from the coast of the Mediterranean, but still from the beautiful banks of the Rhine River here in Germany. And we are delighted of being part and collaborating with the Union for the Mediterranean in this series of workshops. We started already last year. It was very successful. It created a lot of appetite from your side, from our side, participant sides for more. And this is what we are here today to offer to you. So many thanks to all those who worked together with us in getting ready and developing the agenda and organizing such a beautiful opportunity that we have to come together. Why is this theme so important and so close to the work of the World Health Organization? Well, you know, in our constitution, we don't restrict health to be the absence of disease. We want health to be a notion to embrace a notion of well-being. And science has come to the fore particularly over the last, I would say the last decade, but really there has been an acceleration over the last 7 years in this area. And science is telling us that green space and urban green space in particular is not just an aesthetic amenity. It's not just something that is nice to draw when we are designing a new area in a city and we want to have some green space over there. It is a fundamental for the health of the people. It is a fundamental to help us addressing some of the big environmental challenges. For example, adapting to climate change. We can create islands that protect us from extreme temperature, for example. But we can also promote health. So there is not only the dimension of protecting health, which is paramount, of course, but there is a largely untapped opportunity of promoting health. And it is this dimension that we believe should be very much at the focus and motivating the policymakers to do something. It is very often, we know that for local authorities, it is difficult to argue the budgets for the development and the maintenance of a high quality green space, right? But if you do that, not only because, okay, a park is nice to have it and perhaps people will go and play there, but you are going that because it is a part and parcel of the strategic political vision at the city level to make and improve health, then this is where you are. And now what is really exciting is that we are not just speaking anecdotically, we have solid science that supports us, that shows us the links between health and green and blue spaces. And this is a game changer because now we can rest on solid evidence of these links. And I'm delighted that the speakers that are joining us today are here to bring to you in a user-friendly way the latest evidence that we have. So huge potential to make a breakthrough in terms of mental health, in terms of physical activity, in terms of promotion and protection of health. So please be with us, share our enthusiasm, support our work, and implement as much as you can what we are going to hear here. We have a chance to make our lives so much better, and we are fortunate to live on the shores of the Mediterranean, where the opportunities of doing something are beautiful all around the year, and matching the beautiful cultural heritage of our historical traditions. So it is coming together, nature, health, culture, heritage. So I really hope you will enjoy the day today, and many thanks also to my colleagues who have been working with you, and Dr. Netanyahu, Matthias Braubach, on this one. Thanks a lot, Victoria, for bringing us together. Sabri, once again, for introducing us. Have a lovely workshop today. Over.
Thank you, Francesca, and thank you, Sabri, for this beautiful introduction. So we are ready to begin our meeting today. So just a few housekeeping notes. First of all, the event is being recorded. We're also going to have 3 presentations. Each presentation is planned for 15 minutes. After that, we can take 1 or 2 clarification questions. However, we encourage you to add your questions to the chat because after the 3 presentation, we will have a discussion and we can elaborate more. At that time, you will be able to request the floor by virtually raising your hand. So let us begin. So what we want to achieve today is really to take stock of the latest evidence on the impacts of green space on human health. We want to include mental health in this discussion. We wish to exchange views on policy opportunities, emerging approaches, and good practices to design and implement policies that promote health through investment into the protection of nature and green space in urban settings. And we also want to highlight urban tools on nature and health in support of policy making. So we wish to start with the first presentation on urban green spaces, health relevance and action. The first speaker is Matthias Braubach. He works as a technical officer for urban health and equity at the WHO European Center for Environment and Health. He is a geographer and holds a master's of public health. His work focuses on health impacts on urban and built environment with a specific focus on environmental inequalities. So Matthias, the floor is yours. Matthias, perhaps you're muted. We cannot hear you.
Okay, yeah, it definitely helps to unmute. Sorry, you can hear me?
Yes, we can.
Okay. And you can see the screen?
Yes.
All right, so thanks for the introduction and following up on the welcome notes from Francesca. I hope this will be a user-friendly presentation summarizing some of our work on urban green space. So I would like to start right away going into the subject and going first with a more general view that gives an overview of as the population rises, we at the same time have an increasing amount of resource depletion as well as environmental degradation, simply because our lifestyle and our requirements, our demands for material, which is largely coming from nature. So we see that all the demands to natural products are rising, and at the same time we see that biodiversity is challenged and biodiversity is declining. So any type of nature is an added value because we are not having enough of it anyway, and we need to make sure that we use nature in any type of setting in a better way. If you are interested in general on the impact on nature, biodiversity, and health, then these are 2 documents that you might be interested in to explore further. One is a very large and a very detailed overview of the biodiversity and health connections that goes across a wide range of dimensions, not only environmental, but also other health aspects. And then published last year from the European region, an overview report on nature, biodiversity, and its interconnections with health. So this is recommended reading if you want to dive deeper. But I would like to focus first on the WHO work that we have done in recent years on urban green spaces and the health messages, the health impacts. And we have worked on key messages for urban practitioners by having 2 different approaches. First, we looked at a review of evidence on how do urban green spaces affect health. So we wanted to know what is the evidence, what are the pathways, and what are the health impacts. And we designed a model that shows how from the different dimensions of nature, through what impacts and what pathways you can get to what type of health outcomes, looking into physical health, mental health, social well-being, and health inequality. And to put that in a summarized way, because it can be quite complex, I would like to break it down in 4 major pathways how green spaces connect to health. And that is 1, through the environmental benefits affecting the urban heat island, flood mitigation, improving air quality, for example. We have the direct nature benefits for humans, which support our recreation outside, be it the exposure to noise, or I would rather say the pleasant sounds of nature that can buffer and mask and reduce the noise experience. We have the exposure to nature and microbiota, which we do need as a training effect for the immune system. And we have, of course, also exposure to sunlight. You should not get too much, but you also do need a little bit of it at least. We look into the social benefits. Green spaces and the natural areas outside, especially in cities, are great areas for social interaction. It improves community cohesion, and it also helps to promote physical activity outside, be it jogging, sports in the park, or also active transport by the riverside, through the forests, through nice green lanes for walking and cycling. And the final element is mental benefits, enhanced nature connection, being in peace, being calm outside and enjoying nature helps to reduce stress. And there is also the attention restoration, which suggests that if you are stressed and you don't have a lot of capacities anymore, you had a hard day in the office in the morning, you go out into nature, having a break outside, and you are refreshed, and the capacities largely return because of the break. And such a break in nature is usually more effective. So there are different pathways that we can sum up in these 4 major tracks. After having looked into the health impacts of urban green spaces, we then wondered, how do we best ensure that green spaces deliver health impacts? And we had a review of the impacts and the effectiveness of urban green space interventions in different cities. And we have looked at a large number of case studies across the WHO European region. They were coming in completely different formats and shapes, regional or local dimensions, very costly or very small budget, large areas like urban parks, but also looking into small playgrounds. Often green spaces come with blue spaces, or they are useful to regenerate areas or brownfields and industrial sites that are now not used anymore. And they can be turned into something positive for the city. So we looked into gardening, where food is grown for the public. Some case studies included schools, institutionalized settings such as nursing homes. And what most of them combined was that they combined infrastructural action with social promotion. So it's not enough to just build green spaces. You also need to promote them and make sure that people know they are there. They know what they can do in these places, and there is an attraction to really go and visit these areas. What we found when we asked for the main objectives of altogether 48 case studies across the European region, asking them, why did you do that intervention in the urban area? Most of them said that the major objectives, and you see that we distinguish between the main objective in blue, secondary objective in yellow. Most of the objectives looked into, we want to have a better urban environment, or we want to promote active lifestyle. Reducing health impacts is usually not so much a direct intervention objective, but it's often coming in as a very welcome co-benefit that cities are aware of. But the main approach would largely be that we want to improve the environmental conditions. We have then looked at both reports together, and we created an urban green space action brief to inform local actors about the relevance of nature for health and what they can do. And this has been translated into various languages and is a very nice tool guide for action in local areas. And I would like to just present a little bit, looking into the action components, what we have been pulling together largely from the review of the case studies, where cities were showing their experience on what they have been doing in green space in their area, and what was effective and what they recommend for other cities to do. And the first thing is to get people in contact with nature. And what needs to be done, the effective action, relates to putting the green space close to people, arranging for diversity of urban green space types, because there's always different demands from urban citizens, to consider a simple design that makes it easy for people to see, access, and use the green spaces, but also think of the maintenance needs, because green space is built for long term. It's not just enough to build it, you always need to maintain it so it keeps attractive and people keep enjoying the area. We have looked into how you can ensure stakeholder collaboration and especially community engagement, because green spaces need to be built to respond to the demand of the local citizens. Otherwise, they will not be used and the investment is for nothing. So we're looking into how to target specific user groups. What are the positive experience with community participation, how to collaborate with stakeholders and other sectors that have to be involved, because the health sector is not going to build green spaces. We have to work with other sectors to make sure that they are beneficial for health. And also we have been looking, and that's very important because often people look at only the positive side of green space. We also looked at how to prevent and manage the potential challenges and conflicts, because green spaces bring risks and green spaces can quickly be degraded and they don't look nice anymore if too many people are using it. There could be also environmental nuisance, a lot of people going to that place. It could get noisy, especially on the weekend, and neighbors close by don't really get a lot of benefit from the green space because they get all the noise and maybe also the trash and the litter. So there's also areas that you need to consider as potential conflicts. We pulled together some guidance and some lessons learned on how to deal with those challenges and conflicts and make sure that green spaces really benefit health and not vice versa. And I would also like to point out that green spaces became much more important and much more visible with the public spotlight during the Corona pandemic. There was a lot of requests to keep parks open because there was the idea the benefits would be more important than the potential risks. And there was one study that I would like to quote, international study as an online survey, where the coordinators looked into the nature exposure and impacts, and they compared that with the lockdown severity. So the information they gathered was what restrictions came by the lockdown, had people access to outdoor spaces, and if not, did they at least have nature views through the window? And the result was that the symptoms of depression and anxiety in the study participants was going up, the more severe the lockdown restrictions were, but they also at the same time, they went down when people had access to outdoor green spaces and when they had at least natural elements they could view through the windows. So the important thing here is that we know green space is not distributed equally. So the inequalities will have been stronger during the lockdown for those people that don't have access to green spaces, even not in a visual way. And that also has surely contributed and further fueled inequalities in health by the Corona pandemic. So it's one thing to highlight that this type of urban planning and making sure nature is available to people also plays a huge impact in these specific situations where you cannot use the city as you usually would. At the end of my speech, I would just very quickly like to highlight that we have also been doing work on blue spaces. Often blue spaces and green spaces come connected. We're talking about nature in cities. The blue spaces also have an increasing profile and increasing perspective from health considerations. There has been a large blue health project, an EU-funded project, where we also looked into urban planning aspects on blue spaces. And WHO has designed a decision support tool that is looking at the risk and the benefits. It's a tool that promotes decision-making on health through blue spaces. And as you can see, one part of the tool looks into minimizing risks from blue spaces, looking into injuries, waterborne diseases, climate impacts, or vector-borne diseases. And the other half of the tool looks into the benefits and how to promote these benefits through blue spaces, looking into improving mental well-being and physical well-being, and also improving the functionality of ecosystem services that we depend on global as well as national and local level. And you can see at the bottom the link to the decision support tool if you're interested in the blue space and the water bodies and their health promotion effects. You can go there and have a closer look and get some guidance on how things are linked and what you can do at urban level to increase the health relevance of blue spaces. And with this, I hope that was user-friendly enough and gave a nice overview of the work we do and what type of information is provided for local practitioners. I would simply like to have a quote where I actually don't know who said it. It was, I think, during an expert meeting we had at WHO on urban nature and green spaces. Somebody said, if nature were a pill, it would be reimbursed by healthcare insurance. And I think that's a very good way to look at it. It is a very fundamental urban intervention. It affects in a positive way physical and mental health. It helps social cohesion. It's a lot of positive effects. And the main challenge next to making sure we have enough green space in urban settings is to make sure that that it is available locally, easily accessible for all. And that would be a major requirement when working on green space to make sure everybody can access it. And with this, I would like to close my contribution. If there's any questions right away, and then I'll be available for discussion later on. Thank you very much.
Thank you so much, Matthias, for very clear and very good presentation. There was a request for some links of your of the papers that you've mentioned, so I have added
put them into the chat.
Yeah, so I've added one link, and there are some links. If you scroll down, you can see some links, and Matthias may add another links. Also, there was a comment by Daria from the European Environment Agency mentioning that concerning the survey on promoting active lifestyles might not have been explicitly considered in health terms by the respondent, but it really fits into the health promotion framing that Francesca Racciolpi was mentioning. Yes, indeed. And let's see, there is another question here. From the University of, from the Hague University, Applied Science, saying we studied the effects on heat waves on vulnerable populations in The Hague. I'm wondering whether there are any findings about municipalities being able to afford green spaces given the high prices of urban land in most cities and the competition from private sectors and politics involved. So I don't know, if, Matthias, if you wish to address that very quickly.
Yeah, I can do that. As a part of the case studies we compiled across the European region, finances and land price also played a role, though I think the most municipalities were more looking into when you have land, how do you build successful green space, but not having land, not being able to afford, especially when green and blue come together. These are very, very expensive pieces of urban land, especially in central locations. And usually what a lot of cities raised as a challenge is that these places are almost unaffordable because they go for a real high price in the real estate market, and it's very difficult to keep such areas. So it's often from their side, it was more about keeping the green spaces they had and focusing on that to make sure they don't lose green space in central attractive locations, not so much looking into acquiring new spaces. It's more conserving the status quo that they were concerned and prioritizing on.
And competition will increase with respect to land usages. And therefore, we also, in other areas of work that we have developed here in the Bonn office, is how to redevelop contaminated sites to different purposes in order to reduce pressure on land within the cities. But definitely land is under a big competition. There is another question, Matthias, to you, that if you can also address it quickly. Did you also focus on measures improving use of green space in deprived area?
Yes, there was an interesting result that I didn't show in the presentation, but it is in the main reports that I showed, is that looking into deprived areas, it was more looking into the urban strategies were more on a very aware siting and a decision on where you need green spaces. So it's more about where to put them in deprived neighborhoods that often don't have enough nature and green space, and making a decision to increase nature access there. And that was much stronger than looking into specific types of green space or different functions. So they would rather tend to put more or less the same green space, but it's more about the siting and the distribution to make sure that non-green areas get more of that. And that's often the case in deprived areas.
Great, thanks, Matthias. We have more questions, but we will keep them for the discussion. There is already a very interesting leading question that we will keep by Maya Sadeh. We will keep it for the discussion. And we move quickly to the next presentation. Now we want to focus on green spaces and mental health, a review of evidence. And with us, we have Sharp de Vries, who works as a senior social scientist at the Wageningen University and Research in the Netherlands. He is an environmental psychologist focusing on the impacts of nature and outdoor recreation on human health and well-being. The floor is yours.
Good morning. Let me share my screen.
Yeah, we can see the screen. You may want to switch it to a presentation mode.
Yes. Should now be in presentation mode.
Very good. Excellent.
Okay. Thank you. Yes, as was announced, I will tell you something about specifically the effect of green space, but also blue space on mental health. By the way of 2 systematic reviews that have been conducted. These systematic reviews have been conducted by an Eclipse expert working group. Let me briefly tell you something about that. Eclipse is a mechanism to bring science and policymakers together to support evidence-based decision-making on biodiversity.
Sharp, may I stop you for 1 second just to notify the interpreters that there is a problem. The English interpretation, we hear Arabic, so whoever is responsible on interpretation may want to fix it. Thank you.
Okay.
Let's wait for a second.
Yeah, the Eclipse mechanism. In 2017, the French ministry in charge of the environment sent Eclipse a direct policy request. And this is the central question: which types and characteristics of urban green
I
and
still
blue
hear
space...
in the English channel Arabic translation.
Shall I continue or should I wait?
The last words I heard from Sherp was in English. Maybe let's just try. Maybe it has just been changed right now.
Okay, let's go back to the central question then. Which types and characteristics of urban green and blue space have an impact on mental health and well-being? There have been several reviews before, looking at green space especially, and mental health also. The specific one of this systematic review is that we're going into more detail. Which types and characteristics of urban green and blue space are most relevant for mental health and well-being? Okay, to answer this request, the Eclipse put out a call for experts and formed an expert working group, and with financial support of WHO Europe, it was decided to answer the request by means of 2 systematic reviews. Eclipse, it was a Horizon 2020 project to pilot the mechanism of policymakers being able to have questions addressed by scientists. And by now, the Eclipse has been integrated, you could say, in the alternate program. So it is still running, but not as an Horizon 2020 project, but policymakers can still send in requests to Eclipse. Okay, then to the first systematic review. The first thing is, what are the relevant studies to look at your review? Well, we wanted to look at the whole population, no restrictions. Intervention types, it's about environmental interventions. Specific therapeutic interventions will be excluded because we think that the therapist and the relationship between the client and the therapist is very dominant in that type of study. Exposure, we look at outdoor green space only, so no indoor plants. But it could be also unintentional incidental exposure, for example, to street trees. So it's not only about visits to parks, but also what you see when you look through your window. If you see green space, you're lucky. We were especially interested in studies in which, within the study, two different types of green space were compared, of a characteristic of the green space was compared in the study. Since we were interested in specific types of green space, compound measures of green space that are very common in this type of study, for example, using remote sensing and NDVI measures or in land use measures and combining, for example, forests and grasslands, they are included in this systematic review because we're interested in the specific types. Outcomes, we look at a whole range of mental health outcomes, short-term as well as long-term, and it could be about diseases, it could be about momentary mood effects. So the initial search generated 18,000 records to be screened. In the end, final set of 134 eligible studies remained. Most of them were experimental studies, 55 were cross-sectional or longitudinal, and 12 were qualitative. We performed a critical appraisal of the studies, and 2 studies were excluded from the next steps due to having a low quality score. And the synthesis is a more systematic evidence mapping. No meta-analysis was performed. To give you a brief overview of the studies, this is the studies by a type of green space that was studied. You can see we have studies looking specifically at comparisons, our favorite type of study. But there are also studies on only one type of green space. Could be urban green space, could be even trees and plants. As for the characteristics, there was only one characteristic that was studied often enough to review, and it was the biodiversity or perceived biodiversity of the green space. You see the same studies, but now looking at which mental health outcome was studied, was divided in short-term outcomes, momentary mood, for example, and long-term outcomes, for example, overall self-reported mental health or the prevalence of mental disorders. And in the short-term outcomes are mostly used in experimental studies, and mood effect is one of the dominant ones, and physiological stress is the next most frequently used measure on the health side. When you look at the long-term studies are mostly cross-sectional studies, and then you find overall mental health is most studied and subjective well-being. Okay, here you find the two crossed, the type of nature and the health outcome. The colors indicate the direction of the relationship. Green is beneficial. Orange or red is detrimental. The darker the color, the more studies there are, and gray is no difference. The top panel is for experimental studies. The bottom panel is for cross-sectional longitudinal studies. Well, that was a lot of information. To make it more friendly, we have summarized the conclusions for green space. Of the experimental studies, the majority showed a positive effect and only 5% a negative effect of the green space on mental health outcomes. And also of the cross-sectional longitudinal studies, was somewhat smaller majority showed a positive association and 8% a negative one. So positive associations dominate. And overall, the positive effects or associations were found for almost all types of green space. Only for shrubland, dense vegetation, there were indications of a negative effect or association. Unfortunately, there were relatively few studies that within the study themselves directly compared different types of green space. And the conclusions regarding the comparisons is that there are mixed results. In experimental studies, forests seem to outperform parks. In cross-sectional studies, parks seem to outperform forests. And remember that in experimental studies, it is usually about short-term health measures, and the cross-sectional studies are more about long-term outcomes. That might be one of the reasons for the difference. So there's not one single type of green space that works best for everyone, everywhere, at every time. Like Matthias already mentioned, it seems important to have a diversity of green space because different people have different needs. For children, it may help to be physically active if there are nice green play areas. For adults, it might be more important that there is green space that offers a restorative, relaxing experience. For the elderly, it might be that green space offers opportunities for social contact so that they don't feel lonely. With regard to characteristics, I already mentioned that biodiversity was the only characteristic that was studied often enough to have a review on. All the studies on other characteristics were incidental. And the level of biodiversity, perceived biodiversity, tended to have a positive association with mental health. I think it's important to note that most of the studies, I think, looked at perceived biodiversity, and that may be something else than biodiversity in more ecological terms. There's more work to be done there. As we are now presenting for countries around the Mediterranean, I thought there would also be interest in our outcomes for the blue space. The eligibility criteria were quite similar to the one for green space. And this time there were only few eligible studies, only 24. You see the studies by study design. Most studies are cross-sectional and longitudinal, followed by experimental and then qualitative. And most studies looked at the coastal areas. You have the same studies, but now by mental health outcome that was studied. The short-term studies effect was the dominant type of outcome studied, mood, followed by stress and restorative outcomes. That's restoring from mental fatigue, that is. In the long-term studies, it's overall mental health and subjective well-being, again, that are most frequently studied. The general conclusions for blue space mental health and well-being is most studies focused on the coast. The majority of studies was conducted in the UK up till now, when the review was conducted, I must say. And not all inland water categories were represented in the review. Some types of inland waters were hardly studied. And the preliminary finding is that the coast salty waters outperform inland waters when it comes to mental health. Of course, it may be very difficult to realize a coastal area if you're not already on the coast. And I would think that there's a good chance that maybe the Mediterranean coast is even more beneficial for your mental health than the UK coast, but that's a topic for further study. So that was a lot of information, but fortunately all this information is already published, open access. There's a report published by WHO, which is a kind of summary to a large extent of the two reviews conducted by the Eclipse Expert Working Group. But the reviews themselves are also available. I must say, big reports may be more difficult to take in than the summary provided by WHO. Okay, that completes my presentation. Thank you for your attention.
Thank you very much, Sharp. And we will take a very quick question if anybody has any question for clarifications. I do not see any question in the chat. But there was a previous question, perhaps that you may be able to address, that Maya asked about the role of the health sectors and the health ministries in urban green space policy. How do you perceive their role when it comes to the Ministry of Health?
Well, I don't have a good overview of all countries. I think in the Netherlands, the role is growing. We're about to have a new environmental law. And in that law, it says that if you have a change in the environment, the health impact should be explicitly addressed. And that's, I think, a step forward towards integration. Furthermore, from my perspective, when I started doing research on this, then the health sector tended to prefer outcomes in terms of disorders. But nowadays there's more attention for well-being, positive health, and now sometimes there's more attention for the self-reported health than for the prevalence of disorders or the incidences. So that's a kind of change on the health side.
Thanks. And Rosa is asking the question, what the name of Eclipse?
Actually, I don't know what the acronym stands for. I cannot help you, but I think if there's an answer, it will be found on the Eclipse website.
Yes, I'm sure. Okay, great. Thank you so much. And we will come back with more questions during the discussion. So we're now going to move to the third speaker, who will be speaking about increasing green space that will improve, hopefully, the urban health. And with us, Mark Neuenhausen, who is a leading expert in environmental exposure assessments, epidemiology and health risk and health impact assessment, with a strong focus and interest on healthy urban living. He works as a research professor at IS Global, where he's the director of the Urban Planning, Environment and Health Initiative and the Air Pollution and Urban Environment Program. The floor is yours, Mark.
Thanks so much, and I'm very grateful to be here. It's a wonderful morning, particularly after Barca won last night, very well, as you may have seen. So in Barcelona, we're happy except for the weather. I briefly would like to talk about some of the work we've been doing, where we show that an increase in green space actually can improve urban health, in particular, reduce mortality. As you know, in our cities, we often have many problems. I mean, partly due to air pollution, so lack of physical activity and other things. We have at the same time, we have the climate crisis. We've got this urbanization going on. So there's a whole area what always is pretty bad. But what we find now with the green space, that actually we often see a lack of green space, but by increasing green space, we actually can improve the health of the urban population. Here I'll focus mainly on mortality as an outcome. You've heard mental health just before, what's an important outcome, and there are many others, but I'll focus here as one of the main outcomes. Also, what I would like to emphasize is that there is a relationship between, how we do the urban planning, the urban design, how people use the city, and how this leads to environmental exposures and morbidity and mortality. In this case, if you increase the green space in the cities, most of the time there is not much space, so you need to replace something that may be bad, like, for example, the roads, parking for cars, change it with green space that actually may improve the situation for people that can do more physical activity. It reduces some of the air pollution, the heat island effects, etc. Increase social context, and that's then related with better health. You've heard already before from the previous presentations that greening cities and introducing more green space can have many benefits on health through a number of different pathways, including that it mitigates the air pollution, the heat island effects, and noise. I would like to mention also here, it may help a little bit to CO2 sequestration, not so much because the surface area in cities is fairly small, but from a climate perspective, maybe important too. Now, when we think about green spaces, often people think about parks. And of course, introducing new parks is not so easy. Fortunately, we're very fortunate to have many historical parks, beautiful parks in our cities, and we need to maintain them, we need to keep them. And for example, if you look at this, you relax straight away. You're thinking, why do I sit in this presentation? I'd rather go and sit in the park and enjoy and what you have. But what I would like to emphasize, it's not only parks that we're talking about, it's all kind of green throughout the city that actually can be introduced and should be introduced to improve health. So I think what we're looking for, and what many cities do, particularly here in Europe, is that they want to introduce more green space because it's now recognized as being important. Now, for our work, what I present, we use health impact assessment methodology. It's a fairly simple methodology. What we're using, we're looking at what is the current situation and what is the situation we would like to be. We look what is the difference between that. We get some information from the literature, and then we can predict health impacts. I won't go through the different steps, but just to let you know, this is kind of the methodology what we're using. The problem is, of course, getting all the input data for this, and that's the tricky part. So we've applied this methodology to a few examples, few cities, what I would like to talk about. And the first one is my own city here in Barcelona. In Barcelona, what they're hoping to do is to reduce the space for cars and giving more space to citizens. To do this, they want to introduce the so-called superblocks. So on the left side, what you can see is the current situation. We have a grid system in our city. Traffic goes up and down, left and right. A lot of motorized traffic around, motorbikes and cars. The idea of the superblock is to cut off 9 blocks, 4 junctions in 9 blocks, and don't allow the motorized traffic to go into there, but then only active transportation, and also green that particular part. So the idea is to put in, you know, more trees, but also other parts of green that people can enjoy more. So the overall idea is to introduce 500 super blocks in Barcelona. At the moment, we've got 2 or 3, depending how you count on, and there are 30 in process. If you look at the Barcelona city website, you will see there's a lot of information on this, but they're trying to introduce 30 of them. So this is one of them. This is the Sant Antoni superblock. At the top, you see what it was before, and at the bottom, you see what it was, what it's after the introduction of the superblock idea. As you can see, there were cars before, and that's now being replaced by more space for pedestrians and also some cyclists, and also putting in more green space. So what we did, we did a health impact assessment to see how many premature deaths could be saved each year if they introduced more the super blocks, in particular for green space. And we estimated that you could prevent around 60 premature deaths each year as a result of the increase in green spaces in Barcelona. I mean, there are many other benefits that are related to this, including the reduction in air pollution, what we predicted to reduce the number of deaths by 300, also noise and heat island effects. So overall, the super block that can prevent around 700 premature deaths. In this case, the physical activity was a bit underestimated because we don't have very good data yet for how much physical activity may increase if you introduce the super blocks. Another city we looked at was Philadelphia. In Philadelphia, they want to increase the tree canopy cover. In a number of, I think in the North American cities, they have this kind of goal of having 30% tree canopy cover in city areas. And also at the moment in Philadelphia, this tree canopy cover is around 20%, and they also want to get to this goal of 30% tree canopy cover. So we looked at this for if they would increase the tree canopy cover, how many lives, premature deaths could you actually prevent? And so we looked at all different neighborhoods. 19 neighborhoods in Philadelphia already have 30% tree canopy cover. 102 neighborhoods could meet it by planting more trees and shrubs and grass, etc. It could be easily done. At 34, it would be more difficult because you would need to remove some surfaces. Using our methodology, we found that if they would increase the tree canopy cover to 30%, they could prevent just over 400 premature deaths each year as a result of the increase in the greening there. There were more benefits in terms of preventing premature deaths in the areas with low social economic status, because that's what's also where there is normally less tree canopy cover. So that there the number of deaths that could be prevented were 244, while in the higher social economic status 159. Now, lately we did a similar exercise with looking in general at green space within Europe. We looked at nearly 1,000 cities. What is the current level of green space as measured by NDVI? This is obtained by remote sensing. And we looked at if we would increase the green space in European cities to kind of what the WHO recommends, having a green space of within 300 meters of a residence. How many deaths could we prevent? This is work done by my PhD student, Evelise Breira, who's working on this for the PhD and also some other projects related to it. So we assessed the green space. Here, what you can see on the left side are the cities that are included, all the little dots in Europe, including Mediterranean cities. We looked at the percentage of green space in the cities, and the darker the dots, the greener the dot, the more percentage green space there is. And then also we looked at the NDVI, the normalized difference vegetation index, which is obtained by remote sensing. Again, the darker the dots, the more green there is. And the difference between the two maps is that for the percentage green space includes more like parks and larger public areas, and NDVI includes all kind of greening, including urban gardens, whatever you can think of as for greening. What we found from our studies was that 60% of the population has insufficient access to green space as defined by the WHO, and that we could prevent up to 43,000 premature deaths each year in these 1,000 cities if we would increase the green space to what the WHO actually recommends. So as you can see, this is a very large impact that can be achieved on health if we would be doing more green. If you want to know more about your city, if it's one of these 1,000 cities, you can go to our website, what's at the bottom, isglobalranking.org, where we've got data for all the 1,000 cities to see how many deaths could be prevented if there would be more green space in the city. Also, it gives data now on noise and air pollution, in case you're interested in that as well. Now, what do we need to do in our cities? I mean, it's often difficult because we don't know exactly what type of green space it's needed. But recently, an urban forester, Cecil Konijnendijk, came up with this 330-300 rule that got a lot of traction. And a lot of cities got interested in this. And the rule says that, according to him, is that every citizen should be able to see at least 3 trees of a decent size from their home, so through their window. The neighborhood should have at least 30% tree canopy cover, and people should not be living away of more than 300 meters from the nearest major green space or park. So this is a kind of very simple rule what people should have. And of course, I mean, this is not so easy to achieve. It's great to go to. But I think it's something very nice to keep in mind as something practical. Of course, what it doesn't include, what may be important, is how often people visit the major green space, for example, and also about the quality of biodiversity. So that's something to consider as well. Now, the question is always, can we make changes in cities? And I think it's possible. I mean, this is, for example, Seoul. This is where before in the city center, they had a major highway running through the city, and they took it away and they put a nice waterway with green space around, smaller roads. I mean, a much nicer environment actually to be in. This is the Alder Hale Hospital in Liverpool. On the left side, you can see the old hospital with a park next to it. This is Children's Hospital. They asked the children, what would you like to have? We need to build a new hospital. What would you like to see? And the children said, we want to have more park space to go out. And so what I did was put the new hospital where the park was before and put a green roof on top, and the old hospital became a park. So you can see you have a much more green in the particular area here. Then, you know, you have neighborhoods like this, Vauban in Freiburg, what is a sustainable neighborhood, car-free, where there is also a lot of space for green space and also sustainable housing. I think this is something that we could use as a model for future neighborhoods in cities. What is important, I think, is that, you know, we mix things, and this is the Rambla de Poblenou in Barcelona, one of my favorite streets. It's a walking street, pedestrian, with cycling lanes on the side, very few cars, and a lot of trees. I mean, and this is in particular important to provide shading and reduce temperatures. In the summer, Barcelona can get quite hot, but here temperatures are 4 or 5 degrees lower. At the same time, people can walk around, get physical activity. They live there, there are shops there. So it's everything is together in one neighborhood. And I think that's what we need to be looking at in the future for other streets as well. Of course, we need to work with many stakeholders. As public health people, we can't make changes. We need to work with urban foresters, with urban planners, with transport planners. Unfortunately, currently cars take up a lot of space in our cities, and that can be used in a much better way by introducing more green space. And we can give what are the advantages. Just to give you the website for our project around 1,000 cities, we call it the European Burden of Disease Project. Also, Evelise and I are involved in the Go Green Routes project, which looks to introduce nature-based solutions in cities and see what is the impacts on mental health, but gives also a large number of examples that. So I will leave you with this. If you have any questions, I'm happy to take them, or you can send me an email. I recently wrote a few papers and did a little book where you can get some more information around this as well. Thank you so much for your attention.
Thank you so much, Mark, for this interesting presentation. It's really encouraging to see this, so much work is being done. And definitely a multi-sectoral approach is needed. I was wondering if I can also address you with this question that was asked before about the role of the health sector. What is your opinion on that?
Well, I think the health sector, I mean, it's a very important part. I mean, of course, you're talking about either the hospital sector or the prevention. I mean, I think if you look at the hospital, the health sectors, I mean, I think prescribing more use of nature, I think would be very important to get people out there. At the same time, we can provide more evidence about the health benefits of green space. I think still a lot of people are not aware of this, that there are so many health benefits. So we need to make that important. Show that as well. I think it's always interesting, you know, in the past, if you look a few hundred years back, I mean, the hospitals were always set in very nice nature areas. People could go outside. Nowadays, they build a lot of hospitals right next to a motorway. I mean, it doesn't seem to be, for me, the best part to do this. So I think also the health sector should be looking for where they put their buildings, the hospitals, the primary care centers, so that people actually can enjoy also more the green space. But definitely for the social prescribing, I think it's very important that we try to get away from the prescribing a pill to prescribing visiting nature. That's one way forward.
I think that probably the question that was put was also indicating what is the role of the ministries. So, I mean, like from a regulatory point of view, or the involvement of the ministries of health, which are part of government, obviously, and also have a say in planning. So how do you see that we can increase the role of the ministries themselves in advocating for that?
Yeah, no, again, I think there it's the idea is to show and make them more aware what are the health benefits of green space, and also conduct more cost-benefit analysis. I mean, a lot of times, the ministry is dealing with hospitals, a lot of spend on medication, etc., drug use. Cost-benefit analysis are being done, but this is not being done, of course, for green space. And one of the problems there is what you see is that, for example, I mean, if you want to build more green space, the costs are going to go towards the city councils. I mean, they need to put in the cost, and the benefits may come from a prevention, from a health prevention. So the cost and benefits are different in their way, shared by different organizations. I think if you look at drugs, for example, it's the same department that's responsible for the cost and for the benefits. And so they have a stronger need to reduce the cost and increase the benefits. I think if you look at cost-benefit ratios for green space, they probably do much better than many drug treatments around. But it's often easier to prescribe a drug, say for mental health problems, than saying go for a walk for half an hour in the park each day. And one of my colleagues, Jill Litt, I mean, she has an EU project called Resetas. It's all about social prescribing. And I think it's very interesting to see there what are the benefits and also the cost benefits for social prescribing, what she's finding. So I think this is kind of the way forward. That it's been done in different places, but not enough yet, I think.
Yeah, but I think that also the example that you've shown about Barcelona, looking at the co-benefits of the physical activities, at the green space, at the heat, at the noise, air pollution, this is a great argument to show the tremendous benefit and the cost that can be saved as a result.
Yeah.
Mark, there is another question for you on if you can explain more on the methodology of the health impact assessments of green spaces on health. Is there a software or for these assessments, like there is an RQ plus for air pollution impact on health?
Well, I think the WHO, Pier Paolo, is working on a tool for that. I don't know what is the current status of it. I mean, our tool that we have, Utopia, it's relatively simple to use as well. But it tends to work only on a city area. I mean, when you want to increase green space on a larger scale, then you can see the benefits. At the moment, as part of the Go Green Route project and with Evelise, who I mentioned before, we're looking to develop a tool for smaller spaces. Because also within Go Green Routes, there are specific, interventions happening in the city, and we're hoping to get something together, some tool to look at particular mental health benefits, because these are, very prevalent, the mental health problems. So it's easier to actually observe some benefits if you introduce green, and that's one of the things that we're working on as part of Go Green Routes. But if anyone is interested in the methodology, please contact me, and we can work something out for this, what can be done. I mean, it's still, the health impact assessment for this is still in its infant stage. So we're still trying to improve, and it's relatively crude, but I think to some extent, it gives us numbers that we actually can work with.
Yeah, there was another question. Thanks. There was another question about if you use for your assessment, the HEAT tool, the health economic assessment tool for walking and cycling.
We don't use that because we use our own Utopia tool that also includes physical activity, and that uses slightly different assumptions. But I think anyone that's interested in the benefits of walking and cycling should use the HEAT tool. It's a very easy to use tool endorsed by the WHO, and it's easier to use than our tool. So I think it's always very nice to play with. It's in particular for urban and transport planners. And it gives fairly good estimates that can be used from a policy perspective.
Thanks, Mark. Maybe I open the floor to all the three speakers. There are more questions coming up. So maybe Matthias or Sharp or Mark, maybe you want to answer. Caroline was asking, what would you recommend to ensure nature-based solutions are becoming more mainstream? I don't know who wants to come aboard with this. Matthias, do you?
Yeah, I can try to have a go at that. It's a difficult question, and I would then like to comment also on another question after that. I think this is a very broad and generic policy question that is not only coming up after the pandemic, but also related to climate change and a lot of urban challenges that we have seen. That how do we include nature-based solutions? I think this is, as I mentioned in my presentation, there's so many different benefits on the social, environmental, and the health side that you would expect this is becoming more of a mainstream policy. The EU is having a strong agenda on promoting the nature-based solutions. I think that the issue is that you often have urban planning that needs to look into so many different factors, and it's one probably of the softer factors. And here I would like to link to the other question asked before on the health sector involvement. I think if from the health perspective, what you get from nature often is the accidents and the negative impact. So the health system sees the injuries, the sunburns, the encephalitis and infections from vector-borne diseases like ticks that are coming more stronger, maybe allergies to plants that didn't used to be in our cities or forests, but now increasingly are coming in as invasive species. So I think that the health sector often gets the negative side, and they probably don't too often get the information or the value of the nature side. And then I think there is not so much potentially of a push to bring that in, and it remains to the urban planners. At most of the urban planning and green space conferences and events they were always very happy to have people from the health sector participating. I think they are trying to reach out to the health sector and maybe not always understand why the health sector is more active, because for them it is an obvious double benefit for the urban planning as well as for the health side. I'm not 100% sure that health sector always have, and Mark alluded to that a little bit, always have the right data and the right evidence and the right understanding, because they are largely getting the negative impacts of nature interaction. And maybe there is still an underestimation of what is the health impact. And I think that could, to some extent, potentially also contribute to the nature-based solutions agenda, which is probably much more known in the environmental side related to resilience, climate change, environmental features. And there's health effects of that down the road, but I'm not sure that it has fully trickled down in the health system as much as it has for climate change and environmental actors. I would like to hear the views of the other speakers on that.
I think the problem for a health sector is it's still mainly geared towards treatment and not towards prevention. That is one of the big problems. And I think, you know, green space, blue space can prevent many health problems. I think the other thing is there's an issue of awareness of the benefits of nature-based solution. But often what we tend to forget coming from the health sector is that someone needs to pay for this. I mean, and I'm just simply coming back, for example, to the Barcelona superblocks. I mean, they're trying to introduce 30 superblocks. And this is more than 30 million euros to introduce them. I mean, that's quite a lot of money you have to find to reduce traffic and to increase green space. And so now this is what the councillors need to find from and take away from other sources. Now, fortunately, here in Barcelona, what happened because of the Green Deal, I mean, because of the new generation funds, they got the funding to fund the super EAs, the new ones, I think, and so that's become available. And I think that's a very good use of next generation funds coming, and also they're promoting more the cycling lanes and paying from that. And I think that's one of the positive points coming out of COVID. But often it's difficult to find so much funding to do this. I mean, another one, what we have here in Barcelona, It's whether or not put a road under a park and build a new park in Plaza Glorias. And that's also a project of 60 to 80 million euros. And this is a lot of money for the city council to find. And there's always this competing demands from other things. Do we spend it on putting a bit more green in, or do we spend it on social housing or something? And that's the decisions they often have to make. So we need to really make the case that green space is good for everyone and that we need to have more green space. And also, you need to maintain it, what is also quite expensive. We tend to forget it sometimes. And if you don't maintain, you get a tree on the top of a car, and that gets the headline in the newspaper how bad trees are. I mean, no one is going to write about all the positive mental health benefits, physical activity of the trees. No, it's that tree that falls on the car that gets mentioned. So.
And thank you, Mark. We have a person that raised his hand. I just unfortunately cannot read the name, but please go ahead and unmute your microphone. And the name is in Arabic, and maybe the translator can help us and call this person. Okay, I don't see this hand anymore. Okay, but all right, I don't see this hand anymore. I'm sorry. Okay, there were other questions in the chat. There was a question before. I don't know if it's for everyone, but let me read the question. Since a few years, there are many participatory projects engaging citizens to create this so-called tiny forest. Microforest through a specific method called Miyawaki method, a Japanese botanist. These microforests are known to grow fast, being very rich in biodiversity, and are indeed quite small in their size. What do you think about these specific projects? Could they be relevant for green urban planning and to promote healthier cities? Anybody is familiar with this?
Yes, we have in the Netherlands too, the tiny forests, and they are indeed quite small, a lot of different trees. Usually the small forest itself is not very accessible. Only for people that are maintaining the tiny forest. I think in general, it's very difficult to establish what the effects are of a tiny environmental intervention. Small interventions are likely to have a small impacts. If you look at the total of the green space that somebody has in his living environment, then the tiny forest is only a small change in the total. So for the ones that are involved in the tiny forest, in the Netherlands, it usually are school children that do the monitoring of the forest, the growth of the trees. I think for them, some effect is likely. For others, people living very nearby and looking out on it, perhaps. But let's say a tiny forest is likely to have a very small surface area.
Thanks, Sharp. Sharp, if you already have the microphone, maybe I can ask you another question. Mental health problems are rising and likely to become a major burden for societies and health systems. So given the many pressure factors of modern lifestyles, to what extent can urban nature be a solution, or part of the solution at least, to counteract these challenges?
I think it can certainly be a part of the solution, but yes, there are many factors affecting health, also mental health, and urban nature is not will not cure anything or prevent all, but it can certainly have a substantial contribution. And I think it's very important that it's about urban nature that's close to your home. At the moment, we're conducting a large-scale study on the effect of having a garden and the amount of green space within your garden. And we are finding pretty strong relationships for how green your garden is and your and the prevalence of a range of diseases and disorders, diabetes, cardiovascular, also mental. So yes, it can have a contribution that's worth mentioning and realizing.
Thanks. I would like to ask Matthias a question. Matthias, is there a critical mass of urban nature that cities would try to achieve to provide sufficient green and blue spaces to their citizens?
Yeah, I think that's a question that we hear very often, and a lot of local authorities are interested to hear what is the amount that I have to achieve. And I think it is basically, from my perspective, a little bit the wrong way to look at it. I think it is much more about the access and the distribution to green spaces. Not measuring it per capita in terms of square meters is very difficult because it gives you an average, but what this average means is very unclear in practical terms, because if all of the green space is located in the west of the city, people in the east don't have any benefits. And I think there's a nice example from the EU. When Sweden joined the European Union, I think they almost doubled the forest space. And I'm sure that the Italians and the Spanish were very happy about it. And the same applies on a local scale. I think it's more about a relative approach to make sure that we have sufficient space close by to people, and whether that's then above or below a certain threshold may have much less of an impact. It's more important to look at the accessibility, the distribution in the city, and make sure that I think also different needs and different functions. If it's only parks or if it's only playgrounds with some green, it will not serve a part of the population. So it's the functions and the distribution. I think that is counting more than the size as an average sum in general.
That's a very important
thing. Can I support that as well? Because that's one of the things what we found in our 1,000 cities studies was that the distribution is often not very good. You find cities that are very green. They think they're very green, but it's actually not very close to where people live. And what we find is that people like to visit green space what's relatively close, within a 10 minutes walking distance of their home, for example. But also what I would like to emphasize, it's not only parks, it's also just having trees in the street, in the garden, the back garden, this kind of things. What is very important, I think. I mean, that probably you're better off if you can look out of the window and see 1 or 2 trees, nice trees that may give you more benefits than if there is a park nearby that you never visit. So it's important to take that into account. But I think the more green, the better. Most of the time what we see that there is not enough green space in cities. And, you know, just looking around to see how gray it is or how gray cities can be, that's what we need to change.
So I guess that there is no one green or one blue that fits all. I mean, you have to have a mix, and you have to have not just the quantity, but the distribution is really, really critical and in different types. And I think that, Mark, you also showed us that 60% of the population in the study that was made in the US is insufficient access to green space. This is
yeah, that's right. And some cities were very surprised because they said, oh, we've got 20 square meters of green space per inhabitant. But yeah, people have to travel for an hour to get there. So in that way, I like Cecil's 330-300 rule, what takes into account that you have green space around. It's very hard to achieve, we find. We looked in Barcelona and only 5% of people have applied with the 330-300 rule, but it's something to aim for, I think.
2 more questions to you, Mark, a quick one. One, you were asked, what is your opinion about nature-based solutions such as green walls and also green roofs? And another question was about the NDV index that is broadly used to measure green space. Could that be as a weak point in the research body about green space, that NDVI cannot access the exact green space characteristics, accessibility, for example?
Yeah, so to start with the last one, NDVI is a very crude measure, and but you know, in many of our epidemiological studies, we see that there is a health benefit with more NDVI. So it does something. Ideally, you go into the type and quality of the green space, And I think that's the next stage of the research, what's going on. I think green roofs and walls can be very beneficial. I mean, of course, what you have from green roofs is often that people can't see them, but they help to reduce the heat island effects within the city. So that can be quite effective. And if people can go to the roof, it's good. Green walls can be also very effective and nice to look at and help, but they're often hard to maintain. They're quite expensive, and they need to have quite a bit of engineering to make them function well. So that's what stops city council or some people actually using them. While I'm just talking, can I also promote, because in November we have the urban transitions meeting, and many of these issues we're discussing in the meeting. It's in cities here in Barcelona from 10 to 12 of November. Matthias always comes, he loves to visit us, and he will be there, and hopefully others. But some of these issues, what we can do within the cities, will actually be discussed there. So, and I put the link in the chat, so you can see when the meeting is and what is happening, but I think it may be helpful as well.
Thank you, Mark. Thanks for that. Thanks for this information. We are very close to end this session in 2 minutes. So let me just go back to Sharp also and Matthias, and then come back to you, Mark, for last comment, last sentence that you wish to say. Let's start with Matthias.
Well, maybe I can also add something about the green walls and green roofs. I can imagine that many cities that is thought of as a solution, a nature-based solution, because it takes up little space. And it can be beneficial for certain functions, reducing heat stress, for example. But I'm a little bit doubtful whether it will stimulate physical activity, social contact, meeting places, and offers relaxing experience. So it can be helpful, but you still need a variety. Even if space is scarce, I don't think only green walls and green roofs will do it, although they can have beneficial effects.
Thank you. Matthias?
Yeah, I would echo Sharp on that statement. It's probably something that links a lot to the climate change dimension, and also maybe to urban resilience in terms of water management and runoff. But I think it does exclude a few relevant functions like physical activity. It's not always publicly accessible in many areas. So it might be good for some outcomes, but not necessarily as efficient across the board as other green space interventions. What I would like to note also in the discussion on nature-based solutions is that we also see that a difficulty for cities that want to create the cities in a more green way is that citizens sometimes are very much in front of that, but depending on what type of intervention is planned, and I think Mark knows the struggle on the discussion on parking lots. It's okay that the city gets green, but if your parking lot has to disappear because the city should get greener, a lot of people may have a slightly different reaction. So there's also a lot of individual perceptions to deal with. And I think it's one of the problems that nature-based solutions must be a long-term agenda, but implementing it on local level. A lot of individual citizens and neighborhoods will have very different views on what is the best way forward. So it's not an automatic mechanism. I think it always needs adjustment and discussion on the ground. And it takes time, but then also once you change the urban structure, this is probably sticking with you for decades to come, but then it can't be changed within a 6 months planning period.
Thanks, Matthias. Mark, any concluding words?
Yeah, no, I also would like to go for a long-term planning for greening cities, for environmental, climate and health benefits. I think that's what we need to keep in mind. And unfortunately, still, we're lacking a lot of green space in many of our cities, I think. And in particular in Mediterranean cities, they can have large benefits to mitigate some of the urban heat island effects, what is a real problem.
That's very true. Yeah, and we are also reminded here by Rob, who's telling us this is really the outcome can be very helpful to implement the very good WHO manifesto for health recovery post-COVID. So this health recovery and the investments associated with the green recovery and the recovery after COVID definitely should look into this topic of green and blue space in the urban area. And there was also a comment by Stefano mentioning the fact that the green space are not as usually economically profitable as opposed to the space in build up, which is true. The competition over land is obviously always tremendous, but therefore we need to advocate more that part of the economic growth in our society relates to health and well-being, and this is just beyond the GDP and GNP, I guess. So with that, I think we conclude. I thank again to our speaker, Matthias, Sharp, and Mark. Thank you so much. And thank you, Victoria, and the Union for the Mediterranean for great collaboration. And we will, I guess, see you during this year in 2022 with more events. So thank you so much for joining us. Have a good day.
Bye-bye. Thanks so much.
Thanks for joining. Goodbye, everybody.
Bye.
Bye-bye.
Bye. Thank you very much.